You guys are in for a treat tonight. I'm going to introduce our panel to you. Raquel Jones, who was diagnosed with DCIS, ductal carcinoma in situ in 2020. Brittany Shook, diagnosed with stage 3 breast cancer in 2015, and then metastatic breast cancer in 2019. And Shelly Clay, diagnosed with stage 2 breast cancer in 2019. Welcome, ladies. Thank you for joining us tonight. So I want to start with Raquel Jones. So Raquel, you were diagnosed with DCIS in 2020, and Raquel, Brittany, and Shelly, actually, would each of you share how you learned your diagnosis? And Raquel, we'll start with you.
Good evening, everyone. So first of all, let me give you a little history. Breast cancer was not new to me. My mom was diagnosed and died of breast cancer at age 46, and I was 9 years old. Then her sister was diagnosed with breast cancer around age 50. Fast forward, my niece, which is my sister's daughter, was diagnosed the first time at age 30, and I was diagnosed at age 47. I initially started out with discharge coming from one of my breasts, and I went to see my doctor, and they had me to go, and I ended up getting a mammogram. They couldn't tell what was going on. So I had a thing, as I call it, ductogram done, and they said I had a clogged duct. Then they just let me go. So a year later, the discharge came back. I returned. I had more questions. I did a mammogram, ultrasound, and they still couldn't figure out what it was. So I started asking more questions. Well, what about an MRI? And so finally I had the MRI, and that's when they first started seeing things. And then they sent me to get the biopsy. And that's how I was diagnosed, after I requested and started advocating for myself for more testing.
Would you say there was a breakdown in maybe communication in terms of understanding how you even got to that diagnosis?
Yes. I really had an issue with it because, like I said, the issue started in 2019 with the discharge. And then I wasn't diagnosed until December 2020. And I originally started going January. So that was like almost 2 years later that we had been going on with this. And unfortunately, the way that I found out it was confirmed that I had breast cancer was I found out through my chart, without a phone call or anything, or called into the office. And that was very devastating for me.
I think a lot of people can relate to that now, because we are now required by law to put every pathology, everything goes in the chart, whether or not we have a chance to call patients or not. And certainly back then, everything wasn't quite pushed forward as fast, but now it is. And so it's becoming a real challenge, I think, to make sure that those communication gaps don't happen. But what did your doctor say about your nipple discharge? Just curious. So you had this discharge, and did they say, well, this is maybe normal?
Yeah, she said, well, you have a clogged duct. And I was just so happy that it wasn't cancer or anything. Unfortunately, I found out that's where my cancer started. It was in the duct. It was in my breast duct. So yeah, it probably was a little bit more than a clogged duct. Not a doctor. However, when I came back the second time, the first time it was in one breast. By the time I got back, it was in both. I was having nipple discharge. And that's when I continued to ask more questions and start advocating. But I wasn't given a lot of information. It was just, I breastfed 2 kids. And when they say you had a clogged duct, I didn't think much of it.
Yeah. I think we're going to see that advocating for yourself is really a recurring theme. And we're going to circle back to this, because when we talk about the power and the action items part of things, we're going to talk more about what people can do to get beyond that stopping point of either A, this is normal, or B, this is a clogged duct. I want to get to Brittany, though. And Brittany, I want you to tell us your story, if you would. And thank you so much for being here tonight. You look beautiful.
Well, thank you. So my story started in 2015 when I was diagnosed with stage 3 invasive ductal carcinoma at the age of 27. I was living in China, and May of that year, I felt a mass in my breast on the left side. And so I just thought I'll deal with it when I get back to America. Moved back and went and got ultrasounds, and I was told it was a fibroadenoma to come back in 6 months. I took the same reports to my OBGYN, and she told me that she wouldn't go against what the other doctors had said and to come back in 6 months. I just so happened to drop my deodorant, and instead of getting a new bar, I just picked up a piece and rubbed it under my arms. And with my arm in a certain position, I felt a lump in my armpit. And so from Dr. Google, that caused more alarm, because it's like, if it's not painful, it's probably breast cancer. So I went and saw a third doctor who happened to be an oncologist, who then referred me to a breast surgeon who just said, like, let's do a biopsy. And that's when I found out that I had stage 3 cancer. And the surgeon told me, based on the size of the tumors or tumor, they honestly aren't sure how many it was at first, that it started off as a single cell about 7.5 years prior. And 7.5 years prior, I was diagnosed with hypothyroidism, which, come to find out, I never had hypothyroidism. I did lose weight, and I had nipple discharge as well, but they just said it was hypothyroidism. So that's 2015. I was in remission for 2 years. And then in 2019, after my 6-month checkup, about a week and a half after, I started to develop severe bone pain in my tailbone. And at first they were saying, well, have you injured yourself? Which I hadn't. I went to my primary care physician, and she ordered a set of scans. And once she said that I had, breast cancer, metastatic breast cancer, I had to go tell my oncologist, who ordered more scans, and found out that it had spread to my skull base, spine, liver, lung, a portion of my kidney, just everywhere. I was walking around with a fracture in my hip, but it was all because my body started to pretty much give out on me. That I got scans and found out that I had metastatic breast cancer.
That is an incredible story, and you advocating for yourself and getting those opinions and pushing beyond what some doctor tells you, I think is really central and key to your story. And we're going to ask you more about this, but I want to get to Shelly, and I want to let her describe her diagnosis, and then we're going to give each of you guys a chance to talk some more about this and really help people understand, what it is that they need to do. Because I can tell you right now, the ladies in the chat are firing off. They're sounding off about having family members and clients who need second opinions and maybe are too afraid to go, about similar diagnoses, about, what is it that we can do, or being diagnosed with something without imaging. And so I want to circle back, because you have a really powerful story about all of this. But thank you for sharing that. And Shelly, how you doing?
Oh, hello. I'm doing
There
well.
you are. Hey, gorgeous.
Hi.
Happy
Yes.
Thursday. Tell us your story.
Thank you. Well, my name is Shelly Clay. I'm from Atlanta, Georgia. I was diagnosed with HER2 positive breast cancer in 2019. And before I got diagnosed with HER2 positive breast cancer, so I went to the doctor for my regular annual mammogram, and they got concerned because there was something under my arm and my lymph nodes they were feeling. I never felt it. I did myself breast exams. I never missed a mammogram. I never missed any appointments. So I was kind of surprised when they called me back. I wasn't too concerned, because I'm thinking, okay, I get my mammograms all the time. I continue to follow up. So when they called me back, they wanted to do an ultrasound. They did the ultrasound, and from there, they ended up wanting to do a biopsy. Went and got my biopsy. The doctor that performed my biopsy, when she gave me my results from the biopsy appointment, she asked me who put in my clips. When you get a mammogram, a biopsy, they normally put clips inside your breast so they can determine later on, what the diagnosis was. So when she did that and she was reading my results to me, she questioned me about who put in the clips. And this doctor, she has been in practice for, I don't know, about 35 years. So, for me, I wanted to be there. I felt like she was very knowledgeable. And in addition to that, I had my mother-in-law is a survivor, and it was her doctor, so I felt very comfortable with her. But then I started feeling uncomfortable with her because she couldn't remember if she put the clips in me when I got my biopsy done. So in turn, I had to go and get another biopsy because of that, which was very painful. And then there was another whole waiting game. And so when I got the result from that biopsy, she then came back and said that I had triple negative breast cancer. We need to treat it right away. We got to hurry up and get your port inserted. And we're going to have to perform your mastectomy. So I'm getting nervous and, it's moving really fast. And I'm like, okay, well, if that's the case, I'm ready to fight. So I'm ready to fight. But then she, when I got my port inserted, she would never call me back. And so I continuing to call her office. I was never getting any phone calls back. She referred me to the oncologist. The oncologist I went to, she wasn't calling me back. She had a family emergency. So I felt this was about 3 weeks later. I felt like, my care was being delayed, and she's telling me I have triple negative breast cancer, which is very aggressive. So I'm ready to get treated. And so when I did receive phone calls back, I decided to move on to another oncologist. And when I went to the new oncologist, she diagnosed me with a different type of breast cancer, which is HER2 positive. And so I'm thinking to myself, how could that happen? So the first doctor missed doing a fission report, which I guess would tell which type you have and your receptors and things like that. So I had to start advocating for myself, doing research and just, Dr. Google, like Brittany said, and just kind of like, trying to figure out what my own care plan was going to be. So when I went to the new oncologist, she started moving right away, and I started getting treated. And I felt like if I didn't do that, my treatment would have been delayed because I got diagnosed in August and I didn't start getting treated. And I know, we have to do scans and everything, but I felt like if I had triple negative, I knew that it was very aggressive. And the other doctor had already started talking to me about what the care plan was going to be. But I feel like if I didn't do my research and if I had stayed with that doctor, she would have been treating me for triple negative versus HER2 positive, which is a total different medication, a total different cocktail. And I'm not sure what would have happened if I had fought through with her.
Wow.
Yeah.
Wow. These stories make my blood boil as a doctor, right? Listening and sitting here and it's just unbelievable, from the very biopsy itself and the question of where the clips have been placed and, to the port and to really needing to find doctors who would explain things to you. And I know that we have some set questions we want to get to, but I think it's important to point out at this point that, so much of what we see about Black breast cancer is painted as a disease of people with low socioeconomic status, who are uneducated, who don't have resources, and this is a very different picture. And this is what our experience looks like. Our education and our degrees don't necessarily save us. Our working in pharma and working in industry and all these things, right? Like, you all are accomplished professionals. And I think that, it's great for us to see it as a community, but the forward-facing rest of the world need to see and understand that, there are people attached to these tumors, to these diagnoses. And it is not necessarily just a disease of class and of socioeconomic status and of access. Because, when we talk about this, like Raquel, you said you had a family history, right? You knew, yes. You had some ideas about what breast cancer and that experience was like, but had some doctor ever offered you genetic testing? Did you know counseling was available?
I did not. And unfortunately, after speaking with my niece being diagnosed at 30 years old, I also reported that every year I would go to the doctor. I got mammograms at 25 years old, did self-exams every month from probably like age 18. And nothing was ever told to me about this genetic testing. She was never offered it. My aunt, no one in my family was ever offered until I was diagnosed.
And that is really something. And I'll ask the same question to Brittany and to Shelly. Were you all offered genetic counseling and testing?
I was. However, I was after the fact, but I had mentioned before to previous doctors that my dad's mother and grandmother and his aunt all had breast cancer. But I was told, because since it was my dad's side, that it really didn't matter for me. I didn't, it's not genetic in my case, but I did tell my doctors about that. And it was like, because it's on my dad's side, that it didn't matter. But I did have the genetic testing. But I think it was after I was already diagnosed. So,
Right. Even with that family history. How about you, Shelly?
No, I wasn't offered genetic testing either, but as I was doing my research, I learned that I needed to do genetic testing. I have a daughter and I also have a son. And so I'm doing my research for them so that I could, gain the knowledge so that if anything comes up, that we would know before than after.
I think it's important to point out at this point that all tumors, all cells have genes, right? It's the blueprint for what that cell's supposed to do in its lifetime. It's like the plan for its life. And all cancer is genetic in the sense that the cells figure out a way not to die and they keep growing and growing and growing. But not all cancers are hereditary, meaning passed down generation after generation after generation. And when we hear these family histories, when we see young women with breast cancer, when we hear triple negative breast cancer, HER2, when we see this picture, genetic testing should be part of the equation. And so for people who might be watching and tuning in, it's important for you to know that the guidelines for who should get genetic testing are expanding. Because years ago, it was thousands and thousands of dollars, and only a handful of people were offered this testing. And it usually did not include women of color. It usually did not include us. We might not have had the right insurance. Our doctor wasn't thinking about it. They were going to do surgery first and then check the genes later and never got around to it. But genetic testing is indicated for almost a majority of all women with breast cancer. Society of Breast Surgeons now has a recommendation that all women with breast cancer should be offered counseling, should be offered screening and possibly testing. So if you are watching and you have not had genetic counseling for hereditary mutations like BRCA genes and others, you need to talk to your doctor. So a little sidebar on that, because a lot of people watching don't know that the guidelines have changed for that. So I guess now my next question is this. You all are invested, you're doing your research. What did you know about breast cancer before this? Did your doctors sort of prepare you for, what was going to happen for your diagnosis and what to expect? How prepared were you for this, or were you blindsided? Let's start with, we'll go Raquel, Brittany, and then Shelly.
Again, a lot of my information came from others. And as we know, each person is different. Nobody's going to have the exact story. But I had friends in the medical field, and that's where a lot of my information was coming from. By the time I got to when I initially started the process, it was not clear at all. That once I got my breast surgeon, that's when things became more clear to me about what to expect, coming forward. Because prior to me switching doctors, lots of things were left out. Like it was just left out that there were when they did my MRI, that there were some things seen on my cysts on my different things on my liver that was not reported on the report. The only way that I found out about it is when I went to the second doctors, and they had their radiologist to go through all of my scans. And that's how that was revealed to me. I was devastated again. Because that would just happen to be left out by the radiologist. And so I thought about how many other women are you just happen to leave that out when you're looking at our MRI. So once I got to the second, it became more clear of what I was dealing with and what my plan was going to look like.
Let's see. I knew about breast cancer because my grandmother died of breast cancer. And then my great grandmother had it as well, but it didn't click into my metastatic breast cancer diagnosis that she actually had metastatic breast cancer. We all just thought she had bone cancer. So knowing that part, but I still just thought it was maybe from lifestyle choices and, they were older women. So it happens to older women. When it came to me getting diagnosed, I feel like I was rushed. I was told, oh, you get your port, you're gonna start chemo, your hair is gonna fall out in 2 weeks.
Mhm.
Yeah, after that, we're gonna do this. And so I remember asking about fertility, what about harvesting my eggs? And I was told, oh, we'll cross that when it's time. But now I'm stage 4. So it's like, when was there supposed to be time? So there was actually a lot of things I didn't know. So kind of like after the diagnosis, but during treatment is when I started researching more on my own, because I guess the fear had kind of passed. And so I just had like a clear mind to go in and start looking up things for myself. I didn't know that, maybe I knew, no, I'm gonna say I didn't know. I didn't know how high my chances were for reoccurrence, because I was not on any medication for 2 years. But then they were like, well, it's aggressive. But how is it aggressive that I'm not on anything for 2 years? So then with being diagnosed again, I automatically thought like death. I looked, okay, how many years do I have with a stage 4? Because before I'm like, oh, there's not a stage 5, So how long do I have for stage 4? And with that diagnosis, I was told it's a marathon, not a race. And that's about it. As far as what is stage 4, what is metastatic breast cancer? I was given a palliative care nurse, so it was about pain management, and that was pretty much it.
So you were started on chemotherapy, and we had a question in the chat about the therapies that you might be on. Are you on any combination of oral and IV things? If you want to disclose anything about your treatment journey.
Okay, so I've been on a lot of medications. Most recently, when it comes to stage 4 metastatic breast cancer, you keep trying until something works. So in 2019, I was on Kisqali, letrozole, and a shot called Lupron. I was switched from Lupron to also Xgeva to put calcium back in my bones. I think there was something happened with Lupron for a while where doctors weren't getting Lupron. So I was taking off Lupron. Kisqali stopped working for me, which I told my doctors that it stopped working. I noticed when things stopped working. So went from Kisqali, finally got off that. I was on there from November 2019 to about January 2021. Stopped Kisqali, and then was off medicine for a while. Started on what is the shot? Fulvestrant. So started on that. I had maybe like 3 cycles of that after a biopsy. But I could physically feel my liver like becoming bigger. And I was told, oh, it's just inflamed from your biopsy. And I'm like, no, this is more than inflammation. I'm feeling my liver more so towards my rib cage, and I'm feeling it go towards my belly button. They did a scan. They was like, oh yeah, you're right. That isn't working. So most recently, I was put on Xeloda, on oral chemo, 4 pills a day, 2 in the morning, 2 in the evening. Once again, I'm like, this isn't working. I'm feeling things, and come to find out, it's not working. And I just went to my oncologist, I think Tuesday, and informed them, and they felt, and they're like, yeah. And I told them, I think I have fluid. I look like a pregnant lady. And they're like, oh yeah, you do. And I'm like, I've been telling you this for months. I called you guys last month and told you that I felt the message wasn't working.
So you're telling them, you're the one telling them that
yes,
it's not working. Well, I have to tell you, and I'm going to interrupt and say that everybody in the chat keeps saying how amazing you look, and they're not lying about it, because you do. But the very fact that you have to keep bringing this up, did your doctor go over with you? And Shelly, I'm going to get to you in a second, because I want you to answer the same question we've been talking about, what the surveillance looks like and how this goes moving forward. Besides just saying, here's a palliative care doc for pain, did they prepare you for how often you need to be seen? Did they offer you clinical trials? That question's for everybody.
No, I actually brought up a clinical trial
You brought it up
yesterday, because going through intravenous chemo again, my doctor was out, and so the nurse practitioner is like, well, I'll talk to her tonight. So to me, just an overnight conversation isn't long enough. And so it's like, we're going to start you with intravenous chemo next week. We're going to put a port in, and hopefully this works. So clinical trials has not been brought up. They're like, you have to have a washout period. We don't want you to do a washout period. So now we're just trying to, I get scans next week, but it's all from me saying, yeah, no, my cancer has spread. I can physically feel it. And they're like, oh yeah, they touched, oh, you're right. But before it was like, no, just keep taking it. And I'm like, no, it's not working. So that's where I am with my treatment. I haven't seen my oncologist probably in over a month. It's been like her nurses. And so I shall see her next week, because I want to discuss other options instead of just going straight into intravenous chemotherapy.
Thank you for sharing that, because life is really real, and until you talk about what your daily is like, feeling your body and not being able to reach your doctor. And I get it. It's after COVID and we are all swamped. Y'all saw me run in here 5 minutes before this thing started and put on a lift and get it together. Like it's busy for everybody, but I think making sure that you are able to impress upon your doctors when you need to be seen, advocating for yourself, but also knowing that there's certain patients that we know we need to pay attention to because their therapies are in flux, and so I think that this is something that when we talk about action items, reminding your doctor of, and why should it have to be us? Well, because we want to live. And because the doctors aren't getting it. And I hate that it has to be that way. But we're going to circle back to this. I'm putting a pin in this. But it sounds like a bunch of people want to go with you to your next doctor's appointment too from the chat. So you go ahead.
I go Tuesday.
And well, you might have a whole squad of folks
I know
on the Zoom with you. But Shelly, tell us about this experience of learning you had breast cancer and how prepared you were. Like, did you know what hormone receptors were and all that, before your doctor misdiagnosed you with the wrong hormone receptors?
No, I did not know any of that. Once again, through research, I started learning about that. And I was kind of fortunate because I had a friend who had just went through the same breast cancer treatment I was getting ready to face. I was actually her chemo buddy. I took her to all of her appointments. And then when I got my mammogram, we were chatting and I told her, I said, they called me back for my mammogram. And she's like, oh, it's okay. You're healthy. You exercise all the time. You eat healthy. I can't, don't even worry about it. So, in my back of my head, I'm, listening to her, but on my mind still, I knew that I had to return. And so, no, I didn't know anything about HER2 positive, receptors being, negative or positive. I didn't know anything. My mother-in-law was a breast cancer survivor. And, but I don't know, when I, got married to my husband, she had been in remission for years. So I don't know. I just thought breast cancer was all the same across the board. I never knew there were different types. I never knew any of it until I started doing my own research. But I do want to point out that my doctor, when I went to her, like Brittany said, first thing she said, you're going to lose your hair, which I wasn't worried about because we can figure that out, right? She said, then you could end up in a wheelchair. And I'm thinking to myself, you're telling me all these negative things when you should be trying to keep me positive at the same time. So right after that, I knew that I had to switch to oncologists because of it. Because I'm not going to sit here and listen to you tell me that I'm going to die and I'm going to end up in a wheelchair. You don't even know what my plan is going to be. And in fact, you gave me the wrong diagnosis and couldn't remember if you put my clips in after the biopsy. Yeah, so I was very upset about that. When I changed doctors, everything started flowing the way I wanted it to flow. But then I had to do my research for that to happen as well. So although the doctors was giving me information, I was interviewing them at the same time because it was my choice if I wanted to stay with that doctor. If I felt like her bedside manner was good, I wasn't just going to take their opinion.
Love that.
Yeah.
You said something really important. You said while they were interviewing me and asking me questions, I was interviewing them. This
Yeah.
is powerful. And so, you know, let's keep going down this path. We've had some questions about resources, social work. Did you all have access to social workers and navigators and, you know, guidance for what websites to go to and where to look? Or is it all just Dr. Google, Dr. Google? What resources did you have and did your cancer programs offer you? Can we go do a quick round robin on that? Kelly, if you want to start, or Brittany, you can go.
Yeah, I don't remember my oncologist giving me any type of resources. I know maybe a navigator maybe gave me pamphlets on the medication. And they gave me a magazine that had wigs and caps that had hair attached to it. But a lot of it was Dr. Google. I ended up finding Gilda's Club, and I had myself and my parents joined Gilda's Club. And Gilda's Club here in Nashville was and still is a huge resource with information, even the support groups from other people sharing their experiences or have friends that were diagnosed with cancers in other states. They told me about like genomic testing. So Gilda's Club, and then Living Beyond Breast Cancer. And I became co-coordinator for the Young Survivors Coalition. So it's honestly me going out and finding resources because the oncology office had, to me, dated pamphlets like from the 90s. And that didn't make me want to pick up any of it and read it.
The resources that I received through the hospital, I don't recall like receiving anything right after I was diagnosed. Like I said, that was just me asking people that I know, people that were going through similar situations, which is not good because each situation is different. But after, you know, I had my double mastectomy, then I got more information from the hospital about some programs, and I did reach out to them. But eventually I was referred to another nonprofit organization. And that's where I started to really get a lot of resources, meeting a lot of people. And I was like, wow, how helpful this stuff would have been to me when I was first diagnosed. And I was feeling so rushed at the beginning, like, you know, I have this cancer in my body. I want to get it out. You know, what are my options? The support system, that stuff did not come into play till after I had already had my surgery. So I think it is important that when you're first diagnosed, there should be something in place. Like, hey, these are the resources. These are things that can help you get through the process, answer some of your questions. Because you have lots of.
Yes. Sorry, keep going.
Yes, you have lots of them. And a lot of times when you're in there at the doctor's office, you're just trying to take in all the information, and I write stuff down. And then when I leave, I process and I'm like, oh, I should have asked this. I should have asked that. And not having those resources and those people to say, hey, these are things that you should be looking at. Like right now, I'm looking for an oncologist because who's going to follow up with me? Where am I supposed to get that? That's very important. I had a double. I don't have an oncologist. I have a friend that's a nurse, same diagnosis. She has an oncologist that she follows up with. So who's following me? Why do I have?
Your surgeon should be following with you. I have to interrupt here because I see my patients, my double mastectomy patients, even I tell them I'm their primary care doctor for their breasts, whether they have them or not, right? Whether you're flat, you got implants, you have deeps, you have the fat, the tummy, whatever it is, you are stuck with me, right? For the next 5 to 10 plus years, or until you get sick of looking at me and you, it's us. And so you absolutely need an oncologist. You absolutely should be offered some sort of financial resources too. Financial toxicity is a big buzzword right now in the cancer world. Were any of you guys offered financial resources, or did you have to ask and actively seek them out? Anybody talk to you about the money and the finances of breast cancer?
I sought it out.
Okay.
I
did well.
That was challenging for me because I am an educator and I didn't have any sick leave.
Yeah.
And so I had to take off for months without any type of income coming in. And everything that I would reach out to apply, I didn't receive anything, which was until I got with the local nonprofit, My Style Matters. That was the only organization that has supported me through this journey.
I know Tia's organization, and it is,
Yeah, he has been phenomenal. I have received more information and support through My Style Matters about my nutrition. I started eating different foods, plant-based. I went through a program with them. I mean, it has been phenomenal about products I should be using on my hair, what things I should be staying away from.
Beautiful.
I didn't know any of this prior to meeting Tia at My Style. And that actually was the referral that I got from the program at the hospital.
That was a good referral right there. I got to tell you,
Really
that was a real one. Brittany, I want to talk to you about mental health. We're talking about support, right? It's not just support financially. It's not just support from your doctor offering you the right things and giving you the right diagnosis, right, Shelly? But what about your state of mind through all of this and the mental challenges that come? And we'll start with Brittany. We'll hit Shelly. Raquel will follow up with you guys. But let's talk about this is mind, body, and spirit, right? Let's talk about the mind.
Mm-hmm. Oh, well, it's been a roller coaster. At first, I was in denial. I was very optimistic. I'm like, okay, I'm going to give this 6 months and then I'm going to be finished. No, that wasn't the case. They're like, no, your treatment for the original diagnosis, it's going to be years. So I started exercising, finding different groups. Even I was the youngest and the only Black person in pretty much all of my groups. So then that was another mental thing, because it's like, I'm not seeing anyone that looks like me that's surviving. So then I went to a therapist at my oncology office, and I thought I was just going to do some talk therapy with my Kleenex on the couch. And I went in and she's like, so what medicine do you want? And I'm like, I don't want any medicine. As expected, I should be depressed. I should be going through mental challenges, but I did not want to be numbed. So that was like, I maybe went twice and I was like, no, this isn't for me. She gave me a meditation CD. Only place I have a CD player is in my car. And it said, don't listen to this while driving, because I'm supposed to meditate and drive. So I then found another resource that through a local hospital called Guided Meditation. Once again, I was the youngest person and the only Black person there, but that did help me kind of calm down my mind. It gave me different techniques on how to count and help with anxiety, because I remember I would get a few blocks from my oncology office and start to physically feel ill. I would be good the rest of any other parts of the day, but it would be like a block away from my office, and like my stomach's becoming upset. I'm feeling nauseous, not realizing that I was having anxiety attacks. So now it's still a mental thing, because I'm like, oh, whatever pain I feel, I'm like, it's cancer. If I have a headache, I'm like, oh, it's in my brain. Am I about to die? And I've had a lot of friends.
Talk about that? Yes, because there's a lot of questions in our Q&A about that, the anxiety and fear of recurrence. So I want to hear from everybody about this, but please keep going.
Yes. So I felt something before 2019, and then I went and looked back at all the symptoms, and those were all symptoms of a reoccurrence. And so I just kind of put it in the back of my mind, because I was hoping that it wasn't breast cancer again. But in the back of my mind, I also knew, yes, something's wrong and it probably is cancer. So it was also, and then also when your doctor is telling you you're fine, you're like, oh, okay, I'm fine. And so that creates a whole other mental challenge, because it's like, I keep going to this person and I don't know if they want me to live. I want to live, but it's like, if I have to keep telling you that something's wrong, then really, how are you helping me? So that's another mental challenge there. And you don't want in your charts that that you're this combative patient or you're hard to deal with, but at the end of the day, you're just fighting to live and trying to mentally get through that. And nothing was off other than like antidepressants. So it comes a lot from me just trying to figure out ways and crying and having my, what I call my mental health days, where I'm just like, today I am not leaving the house. I'm gonna cry it out. I'm not gonna answer my phone, and trying to handle it that way.
How about you, Shelly?
I wasn't offered any resources. Are we talking about mental health, right? So
Social support. Yep.
yeah, so I'm gonna say I have a sister circle. Thank God for that. And going through my treatment when I got diagnosed, I was in the middle of divorcing my husband. And so I would say to anybody out there, I thought to myself, anything toxic, people, environmental fact, it has to go. Because if they're not going to be supportive, it's very important for your mental health. So when I realized my husband wasn't being supportive, my friends were like, are you still going to go through with your divorce? Yes, I am. My peace of mind is more important than anything. So I divorced my husband and I went through my treatment with my friends, their support, my children's support, and I met the wonderful Tia Tomlin. I was doing a breast cancer walk, which I had been doing for 15 years. And my friend's mom she passed away from breast cancer. So we were doing the race. And at the end of the race, she came over to me. She said, I met a wonderful young lady, and it's a great support group, because she was very concerned, wanted to make sure I was going to be okay. So I got her information, and I looked her up and I signed up for a support group. And from that point on, that became my other sister circle. I got a lot of resources from her, and I've been moving along with her ever since then. I want to say she's a great person. And if you're looking for a great support group, that is one of the ones that I would recommend. And I also have another support group called the Pink Frog Foundation. You guys can look them up. They supported me financially, mentally, and they provided different services for me as well, which I didn't know was out there. I had to figure that out for myself as well. And when I remember leaving my oncology appointment, I left with a book, like an encyclopedia. They gave me a binder. So that was really all the resources I received. I had to look everything up myself, basically, because, the doctors, I guess they felt like I was at the appointment too long. We don't have time to answer all these questions.
Right.
Each time I went to an appointment, I brought a friend or my daughter or someone with me, so that if I forgot to ask questions, they could remind me or write them down. And I remember in one of my appointments, my doctor, she's like, okay, well, this appointment is taking very long. We're going to have to end it. I mean, this is my care. We're talking about cancer here. So I'm waiting in the waiting room for an hour. Why can't I sit in here with you for another hour? So, I had to kind of actually just, put myself in the shoes of, I'm going to advocate for myself.
Boy, that hits home. And I know it because I see, the way even my own office runs late. And the reason it runs late is because nobody leaves until everybody gets what they need. Right. And my patients know. So the people who've been there the longest, they know she might be 30 minutes, she might be 40 minutes behind, but it's because somebody's sitting in that seat I sat in 2 years ago, a year ago, and she's drawing that diagram and she's explaining those things. And they're okay about waiting, but it is really tough the way they do our schedules to get everything in, and not just the scheduling, but when you are diagnosed with breast cancer, it's hard to wrap your mind around everything that's going to happen, because all you hear is cancer, want. And even your family members, like I talk to the family and I draw the pictures and I say, now listen, this is for you, because she just heard cancer. And even though I talked to her on the phone and I prepared her for this, it's sinking in. And so we have to layer that information and that learning and that understanding, because I'm seeing questions in the chat about things like losing fingernails and toenails. And nobody told me that this was going to happen. And nutrition, nobody told me what things I should eat, because I was going to feel nauseous, or that I was going to feel nauseous, or that I might end up in a wheelchair. And so it's important to understand, one, your learning is going to be longitudinal. As I think Brittany said, it's a marathon, right? They didn't tell you what that marathon entails. They just said it's a marathon, but that somebody should be sitting with you at each point and saying, okay, now if you're starting chemo, or after your second infusion, after second round, or after your third round, because they just say, okay, you're going to lose your hair and lose your nails. They don't tell you resources about, what to do for those things. What do you do when you get home and all of a sudden your nails turn black? What do you do if your hair is coming out? How do you prepare yourself physically and mentally? And so I think that, asking those questions, if there's a toolkit or a takeaway from this, it's making sure that you have these things written down and that the people around you are always thinking 1 or 2 steps ahead, not just where we are today, but okay, once she starts her infusion, what can she eat? What foods might not taste the same? What should she expect? What can he expect? And like moving 1 step ahead so that you can be ahead of those things, because neuropathy is real. Right? The numbness in the fingers and toes, the medicines we give to block estrogen decrease your bone density. And so making sure that your bones are strong. Brittany, you mentioned fulvestrant, and you mentioned letrozole and Xgeva, and all these medicines, they weaken your bones. And
Right.
so, having fractures, things like that are things that can happen. Chemo brain, somebody mentioned in the chat about chemo brain being real. So I think, one of the take homes here is that our health systems don't do a good job. Doctors, as much as we might try, even the best intending ones, can't get to everything. But revisiting this and making sure that the nurses even are calling and checking on you and say, okay, this is after cycle 3. How you feeling? Okay, what was your experience like? Okay, what questions do you have? And being that available resource is something that our health system should be doing for you guys. So my next question for you is, did you give feedback to your health systems? Did you tell people, listen, this is the experience I got. It was great. It was horrible. It was indifferent. I moved on because. And what would you advise people who might be in similar situations, who might have had care that was suboptimal? Let's just say it. Right? How can we make this thing better?
We have to speak up, speak out, advocate for ourselves, others. And that's what I'm doing right now. The places where I went and, you failed to put in my chart that I had some issues with some things going on with my liver. You just left that out. So I was like, let me just get through this surgery. But I began writing a letter to that hospital to tell my story, because I have a voice. And I want to know how many charts was this doctor reading? How many other people did he leave things out of? I don't think it was an isolated event. So right now I am advocating, spending my time sharing my story with other women. It seems like every time I meet someone, I'm sharing, like, listen, these are the things that you should be asking. Because what happens is you don't know what to ask. I think a lot of times that's the problem. We don't know. I didn't know that I should have an oncologist following me. Why am I having to go solicit one for myself? Why wasn't it recommended to me?
Yeah, I'm kind of doing the same thing. And I have an oncologist following me. But when I went to my last oncologist appointment, she said to me, Shelly, you're doing so well. You want to just wait, come back every year? I finished my last treatment in February. It's still early. Why would I want to wait for that? You don't want to follow me every 3 months like we scheduled to follow myself? And this is a new oncologist, because my old oncologist left. She was great after I got rid of the first one. So she came from MD Anderson, and I was happy about that. But I was kind of skeptical because, she was a new doctor. So I wanted to do my research for her before they passed her on to me. And I kind of felt like I didn't have a voice in the selection of a doctor because my old one left. And so all of her patients, they just picked a doctor. And so I thought to myself, well, maybe I may not like her. She may not care for me the way I want her to. So I'm going to do my research. So I started doing my research on her. And I didn't realize that in order for you to even get a new oncologist, it's kind of like they have to pick you. They don't just take you because they want to know your care and what's going on, why you're switching. So I had a problem trying to find a new doctor. So I ended up having to stay with the doctor that they recommended me to. I didn't really mind staying with her because I had only had a couple more infusions to go. But then when she made a mistake and said that I was done with my treatment, after she said I had 3 infusions left, I started getting concerned. I had my platelet counts were low at one time. It was the only time I couldn't get my infusion. So I would have 3 infusions left. She came back to me after my platelet counts went up. She said, Mrs. Clay, you're done with your treatment. I said, what do you mean I'm done? You said I had 3 infusions to go. How do we go from 3 to 0? And she said, well, look back at your chart and you've already had 28 infusions. That's your care plan. I said, well, doctor, I said, you told me I had 3 more. So my concern was if my platelet counts wasn't low at that time, would I have went into my infusion without you checking to see if I needed more? Nobody wants to keep sitting there getting infusions. But so then I started researching. I started looking at my chart to see what my care plan was and how many infusions I had, because she really didn't know. She said I had 28, and I asked her how she determined that. And she said, well, look back at your chart. I said, well, do you remember when I started? Because she was an original oncologist. So that kind of, disturbed me a little bit about her. So I'm in the middle of getting a new oncologist to follow me. And she was an African-American doctor too. I wanted to like her, wanted to love her, wanted to give her a chance. But once again, I have to keep advocating for myself because she's ready to release me because she think I'm doing well.
I need you to say that again, because I think that we all agree that representation matters, right? And that our experiences are unique and important. But talk to me more about this interview and the doctor and how it might not be as important the person's race as it is the fit.
Yes.
Because, there's only less than 2% of doctors in this country are Black oncologists, right? So finding one might not be the easiest thing, but that shouldn't hold people back, right? Because I got some people right now who only want to see a Black oncologist and they're having trouble. So talk to those people.
Yeah, and actually the oncologist that the one that left the practice, she was the best oncologist. She wasn't a Black oncologist, and her bedside manners were great. And after, I started getting that out of my mind, trying to support my own race, which I'm not a prejudiced person at all. I feel like all doctors, they could give you the same care. But for some reason, I only turned to her because my mother-in-law was a survivor. I'm thinking, okay, she's a survivor. I had this chance and I'm going to go with her doctor. But it turned out that she was forgetting stuff. She wanted to violate my HIPAA because she was trying to report to my mother-in-law what was going on with my care, which is a no-no. And so she just kept forgetting things, which wasn't good. Which wasn't a great thing. So I would say to anybody, when you selecting a doctor, do your interviews. It doesn't matter what race they are, as long as they're giving you the care you need.
Yeah, I was not able. I wanted to switch to a Black oncologist. I called not disclosing that I was seeing a different oncologist in the same system. They're like, yeah, she's accepting new patients. A friend of mine is her patient, and she's like, oh, she's great. She's like, oh, I'm able to get the Lupron shots. I was told, my office didn't have Lupron. So I'm like, well, I did well on Lupron, so let me try to switch. Originally, they're like, yes. I called to get my records released and see if I could transfer over. I called back. I can't remember which one I called. They're like, yeah, no, you can't switch. You need to be on medicine right now. And I'm like, well, I'm not on anything. So what does that have to do with anything? They're like, yeah, well, she's not accepting new patients. And I said, well, I called about 2 weeks ago and you guys told me that she was accepting new patients. And so then I asked, well, can you tell me like why I was denied? No answers on why I was denied. Nothing from either offices. So I'm like, well, there goes that. And then I went to another facility with a Black oncologist, a Black male, great bedside manner, brought in all my documents because I asked for printouts of everything. And so he's like, I would love to have you as a patient. However, I don't have access to the clinical trials that your oncologist has. And once you leave, like a system, it's hard to get back in. So he was like, I advise you to stay where you are because he just didn't have access to clinical trials. He would get them after the fact. And so I had to make the decision like, oh, bedside manner, someone who seems really caring, or to stay where I am for the hopes of, because she has access to clinical trials, but still she didn't even tell me about a clinical trial. So those are the things that I'm going through with oncologists. I haven't written a letter, but I feel like that I am going to write a letter, because other groups that I'm in and the people that see my same oncologist, it seems like the women of color have more issues with her than the white women. And people are sounding off about it, like her bedside manner. Another lady was like, she never told me about fertility or infertility. And she was like, every time I try to talk to her about it, she dismisses me. And then another friend of mine, another woman of color, she was 26 and died of stage 4. And we were both early stages. And it's like, how of all of us are in your care? And then we go from early stage to being women under 30 with stage 4. So I'm like, this is kind of seeming like a trend here.
Well, it brings up a good question, I think, from the Q&A, full body scans and the different types of imaging. In the context of advocating for yourself, have you had to ask for imaging and fight for imaging, PET scans, MRIs, other things? And have your doctors explained to you why or why not, why they might not be indicated? Because I have patients with stage 0 and stage 1 disease who want a lot of different scans, and there's guidelines for what we follow. But did any doctor ever go through the guidelines and explain to you what you need and why, or they just order tests or not order tests? Talk to me about that partnership and how partnered you are through your surveillance.
No. Now, I would like to speak about this because I asked my doctors when I finished my treatment, I asked about a bone scan. And so she said, no, you're not able to get a bone scan because the medication that you were on, it doesn't affect your bones. So that's what she told me, but I'm still trying to research that myself. And then I got a right side mastectomy. I remember I felt like I felt something there. So I wanted them to check it out. I had a hard time getting her to even approve me to go to get an MRI or an ultrasound. So I sent a message.
Did they examine you? Did somebody bring you in and at least look at you?
Yeah, they did. They looked at me, and I had to be adamant about it. I said, well, she said, well, Mrs. Clay, you've had radiation. I mean, it's not going to hurt if I have it one more time. So let's go. I want to go on and proceed with the MRI. And so she said, well, you don't have to. I said, well, how am I going to be able to tell if, because I had a mastectomy, I can't get mammograms anymore. How am I going to be able to tell? I'm not going to do a self-check, but still, I wanted to know. And she said, well, we don't recommend that you keep getting MRIs on that side every year. So I said, well, I want to go anyway. And I went to get an MRI. Everything ended up being fine. But then the technician, whoever puts in the notes, she recommended me get an MRI every year when my doctor told me, no, it wasn't needed. So yes, once again, you got to advocate for yourself. Keep asking questions, keep being adamant. Don't let them tell you no. If you have questions, don't leave with them unanswered.
I think the biggest thing to ask your doctor is why. Because if there's something that's not indicated, right? You have stage 0 DCIS and you want a PET scan, but you have no symptoms, no family history, no. Your insurance isn't even going to approve these things. And it's not that we can't order it, but it's that it's not indicated according to the cancer guidelines. And so that's why I put into the chat, there are guidelines for what we should be doing. There's a standard of care. And when we have a reason to deviate beyond that standard of care, then we do. Okay, oh, you have new onset back pain, headaches, you got symptoms. Mm-hmm. Well, we need to look into that and investigate that. And we need to partner with patients and ask those questions. But I think it's important for patients to know also what's in the guidelines, right? So you felt something, because we have a question in the chat right now about recurrence, about risk of recurrence and chest wall recurrence after mastectomies. And so recurrences can happen, but when there's no more breast tissue, there's no more routine imaging, right? No more mammograms, right. No more ultrasounds, no more MRIs on a scheduled basis. So your doctor may not offer it to you because it's not indicated. But if you feel something, it's a different ballgame. And
Yeah.
that's why you got to know your body, right? You're checking, you know what your scars feel like, you know where those drain holes were and what that felt like, and you know where the incisions are, and you know what a stitch feels like versus what a pimple feels like, right? So learning your body and then bringing those things to your doctor is where that partnership really has to happen, because, you know, in terms of ordering imaging, a lot of people want a lot of things, but we find a lot of liver cysts and kidney cysts and other things, and you end up getting a workup for a lot of things that don't have to do with your cancer, and that can delay your treatment also.
Yes.
And so there's a balance, and that's why I said the important lesson here is if it's not indicated, then why isn't it? And under what circumstances, and what should I be looking for moving forward? And that's the responsibility of your doctor, is to tell you what to be expecting, because when you leave that presence, you leave her office, his office, you need to know, what am I doing at home? What do things feel like? And let's talk about reconstruction and aesthetics and plastic surgery. I don't know what surgeries you all have had and if you would like to share, but what was plastic surgery, symmetry, reconstruction, oncoplastics, all those things, were they offered to you? And how are you feeling about yourself in your skin and in your body these days?
I'm actually going through reconstruction now. And I have a really good relationship with my plastic surgeon. They have been wonderful. That was offered to me from my breast surgeon at the very beginning. So far, so good. Actually have another surgery coming up really soon. That to me, I'm feeling a little better, but I think right now when you were talking about the emotional, you know, where I am mentally, I think that I can't really even process what my body looks like, accepting the new me. I'm just thankful and grateful, you know, that I'm here. However, again, a lot of times when I'm there, I think about things when I leave. And that's because you have foreign object in your body now. You're like, what does this feel? Well, what is this? Is this normal? Doesn't feel normal. Something's not right. So I had some of those questions the last time I was there a few weeks ago. So now it's just me trying to figure out what's normal, what's not, the next steps, looking at the different options. You know, emotionally, I'm a wreck going back and forth. Well, maybe I should have just went flat, you know, thinking about what you said about reoccurrences in the chest wall, those type of things, because, you know, I'm not getting those MRIs and mammograms anymore. So right now it's just trying to navigate my way through with the plastic surgeon. And like, some days I just wish I hadn't even gone through with it.
And I think that that's a common thing. Like, we have to normalize that plastic surgery is not one and done. And the expectation is that they're never going to be the way they were. I don't care if the scars are hidden. I don't care if, you know, we do the best job surgically. Things change after surgery, whether you have a lumpectomy or a mastectomy. And normalizing that for people, pain, discomfort, shooting pains, the tissue changes, all those things. Like, we don't explain that to patients in a way that I think is good for them to understand and set that expectation. But to your point, Raquel, about reconstruction, recurrences can happen. They are not as frequent, although in Black women, they are more frequent. We are probably almost 39% more likely to experience a recurrence, but that is independent of what reconstruction you do. And I know that it creates more scar tissue and that it's more things to feel and that it can, you know, cloud the picture some, but you certainly have the right to pursue this, and also the right to go flat early. It's not a failed operation if you do decide to go flat. And I think a lot of times our doctors make it seem like, and they can put pressure. We went from not offering Black women reconstruction to now pressuring everybody to get reconstruction and not offering cosmetically appealing flat closures, right? Whatever you decide is okay. And I think that making sure that your doctor understands that, and you have time, right? You don't have to rush into your reconstruction. If you're not ready, if you're still thinking about things, you take the time that you need to make sure that you're in a good state of mind and that you know what things are supposed to feel like moving forward. And your surgeon, you're not just your plastic surgeon, but your cancer surgeon should be helping you with that process too, so that you can know this little knot is fat necrosis. Okay, this is what fat feels like. This is what a stitch granuloma feels like. Because there's all these weird things after surgery that somebody needs to go over with you so you can have more confidence about your reconstructive process. Go ahead, Shelly, were you going to say something?
That's the piece that I wasn't followed by my breast surgeon. So a lot of those questions and things that I have, I'm asking my plastic surgeon, but I'm going to give them a call tomorrow and just let her know that I need to be seen.
For me, I haven't had reconstruction yet. I'm kind of in the middle. I like Raquel. I'm not sure if I want to have that because, like you said, the surgeries aren't one and done. Now, if it was a surgery I can have one and done, this mastectomy was the first time I ever had any type of surgery in my life. And I'm 55 years old. So right now, I'm okay with the skin I'm in. I'm okay living with that one side mastectomy. I feel like, God has kept me here, and that doesn't determine who I am. So I've been talking to my surgeon. I feel like he rushes me sometimes. He's a good surgeon, but he's the head of surgery. So I feel like, when we make our appointments, he's just kind of going in and out. So I'm on the fence. I really like him. He's wonderful, but he's always in a rush. And I feel like that all the time. So I'm kind of considering if I'm going to use a surgeon, I'm not sure if it's going to be him, even though he did a good job. But, right now, I'm not sure because it's a lot of different things I have to consider. Like you said, the shooting pain and if it's going to work or fail. So, I'm thinking about all of those things. So right now, I think I'm just going to stay like how I am. I'm okay with that right now. So I feel like, the
There's no
decision.
rush, right?
Yes,
You have
right.
time. You have the
Mhm.
time to
Yeah.
get all your questions answered, to get that second opinion, to, imagine yourself saying, what if, to go to physical therapy beforehand, prehab, make sure that your body is in the condition you want it to be in so you know what to expect. And I think that that's really, really important. You don't have to rush into these things. Sometimes we do have to move quickly. We get a diagnosis of advanced cancer or things that need chemo. And yeah, we do, and I'll be honest with you in that sometimes my patients, they take a long time to process this, and the tumors can be fast growing. But again, it boils down to partnership, right? When I tell you, listen, I'm gonna treat you like my sister, and this is what this means. And if you were my sister, and here's what I'm thinking, and here's how fast this is growing, here's what our timeline needs to be. Wherever you get your care, this is when you need to be doing X, Y, and Z, and making sure that people understand that. I think, again, it boils down to the partnership. And so I guess my question for all of you is, looking back, what is something you wish you would have known about this experience beforehand? Is there anything you wish you would have known? I'm
I
sure there's a
wish
lot
I
of
would
things.
have harvested my eggs. I wish that I didn't allow the doctors to make me feel rushed. I was thinking about like nipple sparing. I've had a bilateral mastectomy and I had 2 fat transfers and nipple reconstruction, and I'm still like, but because mine came back anyway, I'm like, well, maybe I could have kept my nipples, but certain things weren't discussed with me. I think fully, there's like, oh, well, you can have reoccurrence, but they're mainly saying in my nipples, not anywhere else. And so that part, let's see what else. I think maybe that this is a journey, even though you're still a survivor, or maybe you're a thriver. And also, don't pay attention to the terminology, because I was like all hung up on, oh, I'm not a survivor anymore because I had a reoccurrence. And it's like, no, you are still a survivor. You're living every day. Every day you wake up, you are surviving something. So get it out your head that you're not a survivor. That and also breast cancer will always be a part of your life. Even once you're finished treatment, it still will always be a part of your life. And so I think those were probably the main things that I would say I wish I would have known beforehand.
For me, at my young self at 25 years old, I wish I had known early on to start asking more questions. But when you told me I had dense breast tissue, what does that mean to a 25-year-old? I don't know. I just would kind of say, oh, okay, fine. So when I was told that over and over again, when I was told in 2017, we think we see something, but you're fine, and I go hopping off. Oh, I'm clear this year. And then 2 years later, so I wish that I had just asked more questions. Like, okay, So why am I coming back in 6 months? Are you waiting on the tumor to grow? I didn't know that because I was younger. I was just so happy that, whew, they didn't find anything. So I really think that if I would have spoke up back then, maybe like she said, I could have had like nipple sparing or something like that. But, you know, I didn't have that as an option. I just wish that with my younger self, that I was as knowledgeable and confident as I am now to advocate for myself. That is the biggest, I don't want to call it a regret. This has been a learning opportunity for me on this journey. And if I had to do it all over again, just more advocating for myself when they initially started telling me things that just didn't sound right, but I didn't know because they were the professionals. I was just so excited that, hey, my mom had breast cancer, it's not me. So I was just happy to hear that, hey, you're clear. But I really wish I could go back and just ask those important questions. Why? Why do I have that type of breast? What does that mean? What should I be doing? But thankful for My Style Matters. I think I'm going to be good.
Right.
Yeah.
I love it. Go ahead, Shelly.
I wish, like Raquel said, I wish I had asked my doctor, my oncologist, I'm not my oncologist, I'm sorry, my gynecologist. Every year when I went and got my mammogram, I had been getting mammograms, like I said earlier, for 15 years. I wish I had asked to see the detailed reports because when I got the letter in the mail, all it says is your mammogram is clear. I never knew I had dense breast tissue. The whole 15 years I had been getting my mammogram. So when I got diagnosed and I went to get my detailed report from the hospital, that's when I learned I had dense breast tissue. So I then in turn went back to my gynecologist and said, you never told me I had dense breast tissue. This could be the reason why now we're finding what we're finding. She said, well, all Black women have dense tissue. That was her answer to me. She said, we all have it. Like, it's not okay, though. You didn't tell me anything. You didn't do anything about it. So when I get my paperwork from the hospital, after I get my mammogram, it comes back in the mail and said, you're clear from your mammogram. And so, you know, I'm happy to hear that. But now, going back, I'm thinking, you should have probably sent me for follow-up mammograms all the time, or every 6 months, told me to come back, but you didn't do that. But she brushed it off like, you know, well, a lot of women have dense breast tissue, especially Black women.
And it's true. It's not wrong in the sense that Black women have at least 30 to 40% more likely to have dense breast tissue compared to white women. But what that means, right? Breast density. And this is something when we talk about takeaways, things you should know. You should know what your breast density is. If you still have breasts and you're still getting mammograms, you should know what your breast density is. And on the mammogram letter, it says to you category A, B, C, D. Sometimes it'll say 1, 2, 3, or 4. Or it'll say 25 to 50%, 50 to 75, heterogeneously dense, extremely dense breast. There's these words in the letter that we're required by law to tell patients now. And the density, when you go to the doctor and they go, yeah, you have dense breast, that means they feel thick. That's not the density that the radiologists are referring to that puts you at higher risk for breast cancer. That is the white stuff on the mammogram. And I tell patients, it's like static on a console TV. And I know I'm dating myself, and Brittany, you might not know what a console TV is, but my grandmama had one. And it was this big floor model TV, and it was black and white and the static, and you had the bunny ears, and you had to click, 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 and try to get the picture to clear up. But the more snow on the TV screen, the more dense your breasts are. The more dense your breasts are, dense breast is an independent risk factor for breast cancer. And if Black women have more dense breasts, then we should be getting the Cadillac of mammograms, right? The old mammograms are like the analog TVs, right? The new mammograms are like flat screens, 9 slices through the breast. And so knowing your breast density, knowing your family history, super, super important. Knowing what the plan is moving forward, because what we're finding, this recurring theme as I'm getting ready to wrap up, is that we're finding that people go to their doctor. You guys, you were proactive, you got your scans, and there were things that were missed. And so asking, what is the plan moving forward? Right? How do we know? What should I be looking for? Always thinking that one step ahead. So when you get home, you're not just like, oh, that was a great appointment. I know what happened to me, but now I don't know what to expect moving forward. Thinking about those things and challenging your doctor to give you that plan. So people who are chiming in, what about I've had mastectomy, what's my plan moving forward? Your doctor should be going over that with you. Okay, I'm going to see you in 2 weeks, and then I'll see you in 3 months, and then I'll see you in this. Like, there's a plan for this. It's not just, reach in a hat and pull it out and we'll see you when we see you. So knowing what that plan is and challenging your doctor for when you should follow up on these things. Okay, if this doesn't work, what's our next move and when? Can I get that appointment on the books? Because, you know, life is busy, right? And you might forget, you might circle, you might not, they might be booked. But making sure that that plan is there for you is really one of the big takeaways today. It's been such a great conversation. I do have to wrap up. We didn't get to talk about nutrition, but during this conference, there will be some discussion about nutrition. Someone asked about going vegan and would that be helpful for stage 4? We need to talk about plant-based diets and others. Lymphedema will be discussed at some point during this symposium. And so I want to make sure that everybody watching knows that if we didn't get to your question, we will absolutely get to it through the conference. And then genetic testing, knowing that family history, getting that genetic testing. And if you haven't had it in, say, 5 years, you really should talk to your doctor again, because we have panels now. When I got tested, it was BRCA1 and 2. There's panels of 40 genes, 80 genes. There's more information, and knowledge is power. That's the takeaway here. Are there any closing remarks that you guys want to say? I know we got like 20 seconds each, but if you have any closing, Brittany, you said yours. You were like, stop thinking you're not a survivor, because you are. And I think that's a mic
Right.
drop. But anything else anybody wants to say as we close?
I just want to say, advocate, advocate, advocate for yourself. If it doesn't feel right, doesn't sound right, ask questions, advocate.
Yeah, and if your doctors don't have time to explain the questions and answers that you are looking for, you deserve that, because this is a big step in your life that you're going to. It's a big challenge to face. If they're not answering your questions, you may need to seek a new physician, because they're there to spend that time with you. Don't let them turn you away. And if you feel like you're turned away and you didn't get your questions answered, you know, do your own research. And like Raquel said, advocate, advocate, advocate.
Also say, feel on yourself. I know a lot of people I don't know why sometimes we can be grossed out by our own bodies, but feel on yourself. I feel on myself all the time. And that's how I know if something's right or wrong. I'm like, hold on, okay, I'm feeling some hardness here. And before, I think, like, growing up, you just didn't really touch on your breast. I've never had a mammogram. I've never had a mammogram. I've only had one MRI, but it came from me feeling on myself. And so I advise everybody to feel on themselves and just get in tune with your body. Like, no one knows you more than you, and nobody's going to fight as hard for you as you are.
And don't be afraid to do it, because if the doctor is not willing to spend that time and make that investment, they don't deserve they don't deserve to have you as a patient. You know, there are people attached to these tumors, to these diagnoses, to these lives, and every single life is affected when there's a breast cancer diagnosis. So reach out for your resources. There will be toolkits about the resources. There'll be websites for you to follow. Stay tuned with KIP, with Living Beyond Breast Cancer, with My Style Matters, and just know that as you're asking these questions about where can I go for more information, what are the groups, they're going to put all of this stuff into a box, a toolkit for you, so that you can access these online groups. Do consider clinical research. Do ask about clinical trials early. It's not a last resort. Research is so imperative for us. So I just want to put in a plug for that. I know we're going to talk more about these things, but you know, our genes contain the keys to the universe and the keys to this whole breast cancer piece. And so we need our information so that we can have less toxic treatments, so that we can work on finding a cure for this thing. So advocate for yourself. Knowledge is power. I thank you for letting me host. So thank you.